Hello and welcome. So today's topic is our conjunctiva. What is conjunctiva? It's basically a translucent mucous membrane extends from the posterior margin of the eyelid to the anterior part of the eyeball, specifically up to the limbus part. Now, what are eyelids? I will talk about these later. And what is limbus? It's basically a junctional point in between the sclera and cornea. I told you in my earlier video that how cornea and sclera forms is basically both are the outer part of the eyeball or outer layer of the eyeball. Now, this conjunctiva has basically three parts. First of all, palpebral conjunctiva. Number two, bulbar conjunctiva. And number three, conjunctival fornicis. Now, first of all, palpebral conjunctiva. It has multiple parts. First of all, marginal conjunctiva. It actually presents or extends at the margin part of the eyelid to the sulcus subtarsalis. Now the range or the length is almost 2 mm, and the sulcus subtarsalis is actually a shallow groove area. Is basically a transitional zone in between the skin and the conjunctiva proper. In between the skin and conjunctiva proper, this area is known as sulcus subtarsalis. Okay, tarsal conjunctiva, which is thin, very vascular and transparent, which is firmly attached with the tarsal plate of the eyelid. What is tarsal plate? I will talk about later, not now. Next is our orbital part of the palpebral conjunctiva. Now it is very thin and loosely attaches with the tarsal plate of the eyelid up to the fornix area. Okay. And secondly, our bulbar conjunctiva. Okay. This is very thin, loosely presents over the underlying structures and it's easily movable. Okay. And thirdly, our conjunctival fornix is basically joints, or it acts as a connector in between the bulbar conjunctiva and the palpebral conjunctiva. Okay. Now the microscopic part of this conjunctiva, as you can see in this photo, this conjunctiva has basically three layers. First of all, epithelial layer. Second of all, adenoid layer. And third of all, fibrous layer. Okay. Now, first of all, epithelial layer. This epithelial layer is different according to the different places. Like in the marginal conjunctiva, this epithelium has 5 layers and it consists of stratified squamous non-keratinized epithelium. Okay. In tarsal conjunctiva, this epithelium has only 2 layers, superficial one and deep one. Superficial one is actually cylindrical and the deep one is flat. Now this fornix and the bulbar conjunctiva has basically 3 layers of epithelium, the superficial, middle one and deep. Superficial one is cylindrical, middle one is polyhedral and the deep one is basically cuboidal. Okay. And then in limbal conjunctiva, it is basically 5 to 6 layers. Okay. So these are the basic part of the epithelium. Now secondly, our adenoid layer. This adenoid layer of this conjunctiva is also known as lymphoid layer. Okay. Now it is basically made by fine connective tissue reticulum, and in this gap area, this reticulum, we are getting the lymphocytes. And lastly, we are getting fibrous layer, which is made by collagen and elastic tissues. These layer consist of lymphatic vessels, blood vessels and nerve supply for the conjunctiva only. Now in the conjunctiva, you are getting 2 types of glands. One is accessory lacrimal glands, another is mucin secretory glands. In accessory lacrimal glands, you are getting basically glands of Krauss and glands of Wolfring. Now in the mucin secretory glands, you are getting basically goblet cell, then glands of Mans and crypts of Henle. Now the blood supply of this conjunctiva, you are getting basically 2 types. One is arterial supply, another is venous drainage. In arterial supply, you are getting the peripheral arterial arcade of the eyelids along with the marginal arterial arcade of the eyelids and the anterior ciliary arteries. Okay. And in the venous drainage, you are getting the venous plexus of the eyelids along with the anterior ciliary veins. That's it. In the lymphatic drainage, you are getting the preauricular lymph nodes and the submandibular lymph nodes. That's it. And in the nerve supply, you are getting the branches of long ciliary nerve, then the branches of lacrimal nerves, the branches of infratrochlear, supratrochlear nerve, and also very minor amount of the branches of frontal nerve. So this is all about basic anatomy of our conjunctiva. In next day, I will talk about the cornea. So till then, see you soon and bye.